name is Komal. As a medical student, a topic that has always fascinated me is global health. Say I wanted to be a doctor in Japan. Most of my patients there would pay for their healthcare through health insurance. Say I wanted to be a doctor in South Africa. Most of my patients there would pay privately for their healthcare. But my favourite has got to be the UK because my patients wouldn't pay anything and they'd get free healthcare. Something a little unexpected about this mini globe is actually a sharpener. Something a little unexpected about these healthcare systems is they all don't represent one group of people: migrants. This came as a surprise to me, so I read into their stories and experiences and research. I feel that I can categorise them into three core themes, which I call the three hidden problems. These three hidden problems I want to talk to you through the story of Miriam. Miriam is from Russia, and she lived a good life there, but then experienced war, losing all her family, rape, and being accused of a spy, so sent to a Russian prison. Her grandparents paid a lot of money for her to leave Russian prison and start a new life in Sweden, but that's where she hit her first hidden problem. She was getting gynecological problems and hernias, and she needed healthcare, but she couldn't afford it. She sort of ignored it for a long time, but of course her health started to deteriorate, and at that point she hit her second hidden problem. She contacted healthcare services, but they couldn't understand her because of the language barriers. Once she did get through those language barriers, they didn't take her seriously because she was a migrant. At this point, she knew she needed to seek asylum again after her first initial bad application that didn't go through. But this is where she hit her third hidden problem. 2 further asylum seeking applications, and they were both rejected. She couldn't get the healthcare she needed. Instead, she got it through a charitable organisation. This story of Miriam is not an uncommon story. It happens to almost every migrant all around the world. I feel that there are 3 very simple solutions to these 3 hidden problems. The first solution: universal healthcare coverage for all those, no matter where they are in the world, who are most vulnerable, such as children, migrants, refugees, and those who are homeless. The second solution: identifying the barriers that migrants face in different healthcare systems around the world. This is the work of research activism, to look into their healthcare data and statistics on migrants and discover what are their barriers and how we can best address them. Finally, immigration status should not determine whether or not you deserve healthcare. Healthcare should be given as a human right. Healthcare should be given simply because you are human.